So hello, good afternoon, everyone. As I promised, I'm going to do another webinar today. For those who couldn't join us yesterday, it's going to be general information about ARES, about BioRePeel. All the information, all the webinars with detailed procedures, with detailed training are going to be posted on our groups. And you know what? I can't see myself. Okay, I can see it now. So if you have any questions regarding the procedures, if you have any questions regarding the products, please let me know and I'll try to answer all your questions. This webinar is going to be on our YouTube channel as well, if I manage to upload it, because it's going to be the first time I'm going to be uploading anything to YouTube. But it's going to be much easier to find it if we put everything on YouTube channel. So if you have any question, just ask those questions and we're going to start in a minute. Let me just share the screen with you. But before I share the screen, all the protocols, all the procedures are for professionals only. So you need to have the previous training in the procedures, you need to have the previous training in chemical peels, in microneedling, in mesotherapy. We are organizing masterclass in London Tower Bridge every month. The next masterclass is going to be 15th of September. So that's next month, and it's going to cover all the most important bits. So it's going to cover the skin science. You will learn why is it so important to combine certain protocols? Why is it so important to include appropriate home care? Why is it so important to match the procedure to the client's skin needs? Because every single customer, every single client of yours is going to be different. They're going to have different requirements. They're going to have different protocols. You will find out why we never sell the series of the same treatment. So all that is covered in the masterclass. You can sign up to the masterclass for our website, estderm.co.uk, estderm.co.uk. And we don't take more than 10 students per class. So these are the small groups when we can focus on you, when we can answer all your questions. And the training is going to be led by me and my wonderful friend and great professional, the godfather of the skin science, of the aesthetics, Andrew. I'm going to introduce him in more details, hopefully next week. We will try to do quick live together, but that's it from me as introduction to this webinar. So today we're going to be talking about our product, BioRePeel. And before I start, because I always forget, I need to introduce myself. My name is Agnes Kuzniak and I am CMED trainer. I am also one of the people who managed to invent this wonderful product. So RSAK is called AK because these are my initials, Agnes Kuzniak. So thank you so much. I'm very grateful to the guys from CMED that they named the product after me, and it's because I helped to create it. So who's going to train you better if not the person who knows the product from the very, very beginning of the creation of it? So I'm going to remind you today about the BioRePeel. I'm going to remind you about why is it so different? Why is this product so different? Why is this product so special? I'm going to talk to you about the combination procedure with ARES, of course, about the basic protocols. I'm going to tell you what skin conditions we can be treating with BioRePeel FNZ, with BioRePeel Body, and how to use it effectively. So let me just share the screen with you. So hopefully you will be able to see everything I see. So let's start from the beginning. And I want to mention all the products, not only, I hope you can see everything well. It should all be working now. Let me just check. Yes, I think you can see everything, hopefully. So I'm going to mention all the products which are part of the protocol. It's not like you're going to use just the BioRePeel, and by using or by not using forever, you're not going to make any difference. Yes, you are going to make a huge difference if you follow the full protocol. That's why the protocols are created. That's why the protocols are tested before we release them to the market. So you know how to use the product properly so you can get the best of it. I always say that you can be given a Ferrari, but if you don't know how to drive it, you're going to drive it like a Fiat Panda. So you're not going to get the best of it. You're not going to get the most of the procedures. You're not going to get the most of the protocols. You're not going to get the results you could get if you follow the protocol as you should. So we're going to start with contraindications to the treatment. Of course, all the contraindications is going to be diabetes, kidney disease, skin cancers, different types of cancer. And if your patient, if your client had a cancer treatment, you can start any procedures, at least in UK, 5 years after the treatment was completed, after the chemotherapy was completed, was finished. So the patient is clear. And 5 years after that, you can start any treatment with the permission from the leading doctor. Keloid scarring, we do treat keloid scarring, but I'm going to tell you about it during the masterclass. Autoimmune disorders, thyroid, absolute huge, vast amount of autoimmune disorders which we are dealing with at the moment. It could be arthritis, it could be thyroid, it could be any autoimmune disorder, any inflammation, long-term inflammation, which is causing absolute havoc and damage in the body. All those have influence on the treatment, are contraindicated. Why? It's very simple, because the body is already fighting with one inflammation. So if you're using BioRePeel topically, you're not going to have serious complications. In case of thyroid, you can have the longer recovery period, so the skin can be peeling more. The skin can be dry for a longer period of time, but it's nothing serious. But if you're going to combine it with microneedling, with mesotherapy, or with other more invasive procedures, I would recommend you to get permission from the leading doctor, to consult your doctor, to consult your medical practitioner, and get the opinion on the treatment. COVID vaccine for 2 weeks before and 4 weeks after is because we can expect a cytokine storm, which is overreaction of the body to inflammation, which we're going to be causing by doing microneedling treatment. And of course, pregnancy and lactating, and we're not performing any chemical peels or microneedling or any other treatments, invasive treatments. So BioRePeel, let me just remind you very quickly about this wonderful product. So the BioRePeel, very safe, effective, painless. When I'm saying painless, of course, your client, your patient can feel a little bit of tingling sensation. If the skin barrier is compromised, they could feel a little bit of burning, but it's very, very quickly settling. So it's not going to be like they can't stand that treatment. It can be a little bit uncomfortable, but it's not painful. Biphasic technology, we have 2 phases in this product, lipolytic and hydrophilic phase, and when you open the bottle, you can see them very clearly. It's a patented formula, which means, of course, we've got lots of companies who are trying to copy the product, but BioRePeel can be only one. There's going to be only one formulation which cannot be copied, and the formulation is done in such a way that it's stable. So amino acids are stable, so the peels are stable. Multi-action. Why multi-action? Because you can treat any skin condition with the BioRePeel, and I mean any skin condition. So we're starting with aging skin, with dehydrating skin, post-summer when the skin is sun damage. We can treat rosacea, we can treat scarring, we can treat acne. So basically any skin condition which you are going to see in your salon, see in your clinic, can be treated with the BioRePeel CL3. Immediate effect, yes, because you've got immediate effect post the treatment. It's due to the ingredients which are in the pill, and I'm going to tell you about those ingredients in a minute. and the long-term effect. By long-term effect, I don't mean that you don't have to repeat the treatment at all once you finish the sessions, because we cannot stop aging process. Our telomeres are shortening, that's leading to aging. We've got inflammation in our bodies, that's leading to the avalanche of free radicals creation. And so that's all leading to faster aging. But by long-term effects, I mean that we can slow down this aging process by delivering all the right substances, by stimulating the skin, and stimulating, not overstimulating, which is very, very important. The product is appropriate for all phototypes, so Fitzpatrick 1 to Fitzpatrick 6, for the whole body, and you can use it all year round. So summer, winter, spring, whenever it's sunny, whenever it's rainy, autumn, you can use it all year round. The product is not photosensitizing, which is very important. So as I told you, 2 phases, lipolytic and hydrophilic phase. Let me just check very quickly, because I've got some questions here. So the lipolytic phase and hydrophilic phase, protective antioxidant action, moisturizing, firming, and also carrying action. So the active ingredients are being carried deeper inside the skin. Hydrophilic action is hydrophilic phase. It's where all the action takes place. So you've got TCA, AHAs, DHAs, PHAs acids, amino acids, vitamins, and GABA. And GABA, it's one of those ingredients which is going to give you this immediate effect. BioRePeel, what does it stand for? So all those biologically active ingredients, so amino acids, vitamins, GABA, arginine, then you've got peels, so you've got TCA, lactobionic acid, salicylic acid, tartaric acid, citric acid, squalene and isopropyl mistrate, so protective phase, which protects from oxidization of the product. So this phase which you have on top of the BioRePeel, let me just open the bottle and show it to you one more time. See this top green, dark green phase? That's the protective phase. The product is stable. You don't need to keep it in the fridge, but it's stable between 5 and 25 degrees. So if it's really hot outside, like it was yesterday in UK, over 30 degrees, I would just keep it in the fridge. For how long can you keep it? Once you open it, please, please, please do not leave the needle inside the product. You need to take the needle out, and then you can keep it for a month, no longer than a month. But I'm sure you won't have to keep it for longer than a month, because you're going to use it on your clients, and I will tell you about how frequently you should be doing the treatment and how it should be performed. And once again, I'm just stressing that this treatment is the salon-only treatment and should be performed only by trained professional. The professionals which had training, practical training, if they want to use any advanced procedures, they need to have practical training and always ask for their certification. And you can always check if the academy which the practitioner got training from was an accredited training academy. Next one, what else is so important? Amino acids, glycine, proline, hydroxyproline, vitamin C. That is really important, because amino acids are building blocks of every single cell. We are producing, our body is producing around 10 amino acids. We need over 30 amino acids, 29, 30 amino acids in order to keep our body healthy, in order to keep ourselves healthy. Glycine is the most abundant amino acids in collagen, over 35% of the single amino acids in the collagen. Proline, again, collagen synthesis, support of the collagen. It has elasticizing properties. Why am I always, when I'm talking about the collagen, I always mention the face massage. When you do the BioRePeel, it's a very good time to do the face massage, deeper face massage. Why? Because it's not like by adding or promoting more collagen proliferation, you're going to enhance and make the skin look better. When someone has very damaged skin, when someone has lots of collagen loss, the collagen is brittle, the collagen is cross-linked, you need to remove it first. You need to help your body to metabolize this old collagen. So by doing face massage, and we're going to be talking about it in a webinar as well, in a maybe different series, you are helping to metabolize it, you're helping to remove it, and then promote new healthy collagen creation. Coming back to amino acids, hydroxyproline and vitamin C. Vitamin C is essential cofactor in the collagen synthesis, and I always promote it with my clients, with my patient. Daily use of vitamin C. My favorite combination is vitamin C, vitamin E, ferulic acid, of course, curcumin, turmeric. Those are the strongest antioxidants which I use daily, and which will really make a difference for your clients. Of course, you need to be careful with the rosacea clients, because vitamin C at first, when you are just rebuilding the skin barrier, could be a little bit irritating, but there are ways of avoiding it. For example, applying it on a dry skin. So when you wash the skin, don't apply the product straight away. Wait or dry the skin properly. You can do it with a paper towel. You can just wait for the skin to dry and then apply the product. That will stop irritation, that will stop this burning or itching as well. But maybe more about it when we going to be talking about the rosacea in a different webinar. What else is in the BioRePeel? Of course, GABA, non-essential amino acid. It's a chief inhibitory neurotransmitter in the central nervous system. So what does it mean for you? It means that it's going to relax all those lines and wrinkles. So I love when you're using BioRePeel around your eyes. It gives you immediate relaxation effect, like the skin is nice, relaxed, all those little lines and wrinkles are disappearing, and this is thanks to this amino acid. Arginine, absolutely love it. It regulates the blood flow. It's responsible in our body for regulating the blood flow. That's why you will be able to find it in the blood pressure tablets for those people who have high blood pressure. They very often take arginine. But for us, it's important because it helps with angiogenesis. So all those skins, problem with rosacea, problem with the redness of the face, problem with dark circle underneath the eyes. So if the origin of it, it's the vascular melasma, you need to strengthen the vessel. You need to get rid of the iron deposits as well. Otherwise, you're not going to have effective treatment. But we teach about that more in details during the masterclass in London. But arginine is going to be very important for you. Next one, vitamin B2. Vitamin B2 is very important for acne skins, for the skins which are problematic skins with overproduction of sebum. But then again, if you're offering vitamin B complex injections and someone has acne prone skin, in certain cases it can make it worse. So I'm going to be talking about it during the webinar dedicated to treatment of the acne skin. And of course, BioRePeel can be used for that. And now moving on to the acids, TCA. I love TCA. I've been using it for many years. The problem with non-stabilized TCA was that you had very long recovery period. TCA in BioRePeel is in its stabilized form. What does it mean? It means that even though it has all the actions of the TCA, you're not going to have long recovery period. You're not going to have flaking. You're not going to have peeling. Of course, if the skin barrier is compromised, and remember, the most important in your whole treatment plan is to make sure that the skin barrier is being rebuilt, that the skin barrier is being attended to. The skin barrier is the protective barrier, which not only protects the body from losing too much water. Our body loses around 300 milliliters of water a day. So it's a big glass of water just through the skin. And if the skin barrier is compromised, your skin, your face, which you are trying to moisturize, is not going to be able to maintain this moisture in the skin. So applying just hyaluronic acid on the compromised skin barrier and not applying all the emollients which are going to keep this moisture, and you need to rebuild the skin barrier after every single use of the chemical peels, including BioRePeel. We've got products for that, of course. So I'm going to talk about our BioRelief in a minute, which will help you to rebuild the skin barrier, as it contains all the ingredients which are not only moisturizing, but also which are very rich in omega-3, omega-6, omega-9 acids. But that in a minute. So the main action of the TCA, it's not exfoliation, it's activation of the stress response system, activation of the growth factors, so vascular endothelial growth factor, palate-derived growth factor, alpha and beta-1 growth factors, so the keratinocytes, cellular proliferation, differentiation of the keratinocytes, so speeding up the cell metabolism, which is very, very important for the skin to look youthful and good. Of course, salicylic acid. So when you see salicylic acid, you know it's going to be good for those oily acne skins. But not only that, salicylic acid is going to loosen the bonds between keratinocytes and will allow for a bit bigger, deeper penetration of the active ingredients in the peel. Lactobionic acid, moisturizing acid, but also it reduces the action of metalloproteinase, which is the enzyme degrading, protein degrading enzyme. So we don't want that. And metalloproteinase is produced in large quantities when there's inflammation in the body, when there's lots of free radicals as well. And there's lots of talking about the free radicals. We need free radicals in our body. We wouldn't be able to live and survive without free radicals. So if someone tells you, do everything to get rid of the free radicals, it's not good. We need free radicals. We need metalloproteinase. Yes, it sounds bad because this is enzyme which is degrading protein, but without that, our body wouldn't have the way of making new sort of pathway for the vessels, for the microcirculation, for all the essential, blood flow. So we need everything what is our body. We don't need when there's too much of it, yes? So we don't need free radical chains, but we do need free radicals. So overtaking antioxidants, overdosing antioxidants, it's never good. We have to have everything, but everything in the right percentage, everything in moderation. So we need to think about that as well. But if it comes to our skin, when it's so much pollution, when there's so much external stress, external aggression, products containing chemicals which also irritating the skin barrier, I recommend externally antioxidants every single day. So once again, vitamin C, vitamin E, ferulic acid, curcumin, turmeric, my favorite combination of the products. So if it comes to BCAs, AHAs, BHAs, SHAs, and TCA, that's if it comes to the BioRePeel. So what do we have? 35% of the TCA, BHA, so lactobionic acid, BHA, so beta-hydroxy acid, salicylic acid, tartaric acid, and citric acid, amino acids, vitamins, and GABA. And of course, in lipolytic phase, squalane and isopropyl mystrate. And the product comes in the box. So you have vials in the box. You've got 5 vials, 6 milliliters each. And once you open the vial, you can keep it for a month, but don't leave the needle inside. Yeah, make sure you take the needle out. If it comes to the treatment protocols, without any microneedling, you're doing one treatment every 7 days, 4 to 6 sessions within 1 week, one weekly session for 4 to 6 sessions. And recall protocol is after 3 months. Honestly, I've been doing BioRePeel since it was released on the market all the time. So I'm doing it every 2 weeks all the time, and effects are amazing. I'm really, really happy with my skin. You get this glow, so it's not that it's hot. I do have this, I don't know if you can see that, but I do have this glow on the skin, but actually I like it. You know, some people don't like it, but I love this glow. It's a really, you know, healthy looking skin. You don't have to wear makeup. If you don't like the glow, of course, you can use something on top of it to mask it, but it's not like an oily glow. It's just a healthy glow after the use of BioRePeel and RS in the combination procedures. Body product. So then you have 3 vials, 12 milliliters each, and everyone who's purchasing, I really, really encourage you to check and to purchase from official distribution. It's really important, so you can get safe, so you can get original product, and then you can get advice. If something goes wrong, you need to get advice from somewhere. And sometimes, you know, I'm based in UK, and sometimes people write to me what to do about the skin, you know, what to do if I have complications. If you didn't purchase from us, or if you didn't purchase from the distribution, we can't advise you, simply because we don't support illegal sources of the BioRePeel sale. So as simple as that. Check who's the distributor in your country and purchase from the legal distribution. Body, if it comes to the face, I'll come back to the face. For the face treatments, face, neck, and décolleté. So face, neck, and décolleté, it's the FND. Also, the intimate area is going to be FND. It's not going to the body version. It would be too strong for the intimate area. Body, discoloration under armpits, any problems on the body, stretch marks, any discoloration on knees, on elbows, whatever you can think of. Pedicure, absolutely amazing with the BioRePeel FND, body, sorry, not FND. So what you do, you take 3 milliliters each for each foot, 2 to 3 milliliters for each foot. You massage it in, you leave it for 10 minutes, you rinse it with water, and you have the most amazing pedicure. Not only exfoliation, but also repair of the damage of the dry skin. So use it as the pedicure product. You're going to absolutely love it. I will show you very quick video with one of the treatments. So that's going to be Forever and the BioRePeel. Brilliant. So that's a very short video of BioRePeel treatment. Preparation is vital. I always use Forever, and if you use it, you're going to love it. What does it give you? It gives you much better penetration of the BioRePeel. It gives you this preparation, this moisture on the skin. Phenomenal. What else can you use it for? You can use it as a standalone treatment. So you can use it when there is a little bit of flaking, when there is a little bit of peeling. You can invite someone to the salon, do it on the day 3, day 4 as a standalone treatment. You can also do it as a standalone treatment for acne skins. Or if someone wants this amazing glow, invite them to the salon, do Forever treatment, and then do RS Yellow 1 antioxidants with microneedling. Absolutely phenomenal treatment. It will give you this amazing canvas for the makeup if you're wearing makeup. If you don't want to wear makeup, this is the glow you're getting after RS treatment. So really nice, healthy looking skin, and I think that's the most important when we what we're trying to achieve. So natural, healthy looking skin without any pigmentation, without any discoloration. But what's inside Forever? So inside Forever, you have 3 different products. The first one, it's Forever Lipogel. So the Lipogel is going to include Sancha oil, almond oil, and sunflower oil, micronized silica, spherical micronized silica. So you've got this dermabrasion, but you also have all the products containing omega-3, omega-9, omega-6, vitamin A, tocopherol. So you see how rich this product is. It's a gel, which you take a little bit of this gel, apply it on the face. Massage it in. And massage it in. Don't forget to activate it. 10-15 sprays. Actually, I love it on my face. I'll tell you why in a minute. You activate it and then it's foaming. So you don't have all those silica spheres. You don't have those granules because they all dissolve. They all dissolve, so they are very easily removed from the face. So once you remove it, you use gauze. I don't have gauze with me today, so I'm just going to use a tissue. Then you're going to apply a salicylic mask. What's in the salicylic mask? Of course, salicylic acid and vegetable carbon. How do you use it? After you removed the first product, you are applying nice layer of the carbon mask. Yeah, I'm just trying to do it like this. You're waiting for 5-10 minutes. After 5-10 minutes, you're going to spray it, and I'm going to show you how easily it is removed from the skin. You need to wait for 5-10 minutes and then spray it. Don't spray it straight away. Don't try to remove it straight away. I will leave it on my hand and show it to you later on. So vegetable carbon, a very purifying, detoxifying action, absorbing all the pollutants, skin impurities. Of course, salicylic acid is going to allow you for the better preparation of the skin, for the better penetration of the product, of the BioRePeel. So try to use it before. If you haven't used it, try to use it before, and you'll see a really big difference in the treatment. You'll see how much deeper the BioRePeel is penetrating the skin. And my favorite, which I always have in my bag, and I'm spraying it during the day, it has vitamin C, white mulberry extract. So ingredients such as vitamin A, vitamin B, vitamin C, E, magnesium, copper, selenium, carotenoids. So those ingredients are not only protecting the cell membranes from photoaging, they reduce elastosis of the skin. Ruscus extract, soothing, illuminating. It will increase the blood flow, circulation. You know that the blood flow is the most important if it comes to the health of our skin. That's why I always ask. You see, I'm not training in fillers. I'm not using fillers. It's not that I'm against. I just don't do it because when I started working as a plastic surgeon's assistant, I could see how much damage could be done if there's too much of anything. And when there's fillers which have been there for a long time, or maybe too much of it, they're causing the damage to the micro vessels, to the microcirculations. Very often you see the ladies which had either migration of the fillers or simply filler for a very long time with sort of like a brown line. It looks like a bit of a mustache. That's from the inflammation and activation of melanocytes. And that's also because of the micro vessels damage caused by the filler. So there's something like, it doesn't have influence on your health. It doesn't exist. I'm going to be talking about, I'm completing research. I'm completing my learning about fascia and the importance of the fascia. And what I've learned is how dangerous is to offer Botox, if it's not medically necessary, to slim down the face. The masseter muscle is facially connected with your internal organs, especially for women, but I will talk about it a little bit more in detail when we're going to be talking about fascia and the importance of fascia and why some treatments don't work. And that's actually not the treatment, it's actually what we put in our bodies. And I'm going to be mentioning implants as well. So it's like a preview of the next Zoom webinar. Now, I think 5 minutes is gone, so I'm just going to spray it and look what's happening. I don't know if you can see that. I simply removed it from my hand in one piece. Yeah, very easy to remove. So if you're doing it properly, there's no such thing as, oh, I'm finding it difficult to remove, because you remove it as a peel-off mask. So very, very easy to remove. Okie dokie. Post-treatment, before I move to RS post-treatment, BioRelift and BioRehydra. Over 20 active ingredients in both products. So we've got micronized hyaluronic acid, we've got biostimulating, revitalizing, lifting action. If it comes to BioRelieved, 4 biomimetic peptides enhanced by colloidal platinum. Colloidal platinum is super important because colloidal platinum is going to have influence on electrical balance of the cells, and electrical balance of the cells is always disordered, imbalanced after we put any needle, after we cause injury to the skin. So we need to bring this electrical balance back in order to allow for the good cellular communication. And please remember, cellular communication is very, very important. The quality of extracellular matrix is very important in all treatments, in all skin conditions. Micronized hyaluronic acid, amino acids, vitamins, that's all in what you find in post-treatment products. So the peptides which I mentioned about, you're also going to have the peptides mimicking a poison of a viper. So neuropeptides, which is believed to block the body uptake of sodium ion. So what it does, it helps to relax muscles and prevent the formation of the lines and wrinkles by blocking the receptors present on acetylcholine muscle cells. Simply stops their contractions. It doesn't work like Botox. but it works in a very similar way and much healthier way. Again, synergy of 4 peptides in a single release system through the bond with copper. So special delivery capsule promotes production of the collagen, of the elastin. It will target the matrix proteins, so elastin, proteoglycans, laminin, fibrosin, and collagens. And peptide with modulating action. What is very important, this peptide is used to create 3D structure of collagen, so guarantee the perfect trophism and elasticity of the skin. And colloidal platinum, which I mentioned to you, and of course different weights of hyaluronic acid. And we also have not only high, medium, and low molecular weight hyaluronic acid, but micronized hyaluronic acid, molecular weight 5 to 10 kilodaltons, which will penetrate the skin barrier without skin barrier being compromised. So very important. Amino acids, of course, I mentioned about amino acids earlier on, about the action. Vitamins, tocopherol, panthenol, which is vitamin B5, so very calming, soothing for the skin. Isoleucin, leucin, valine, again, amino acids. Vitamin C and vitamin B. And those essential oils essential to rebuild the skin barrier. So argan oil, almond oil, shea butter, and pisabol. So anti-redness, anti-inflammation. They will help protect you from the ultraviolet rays, promote collagen production, suitable for all skin types, which is very important. And BioReHydra, it's a gel. So how I use it, I use BioReHydra first, very little, really little amount. So this amount, I will show you, just open it, if I manage. Let me just, okay, use a little bit of force. So this is how it comes. One pump. I don't know if you can see that. Probably you can see that, yeah. One pump, that's enough. I'm not going to waste it. So of course I'm going to use it on myself. One pump is absolutely enough for the whole face, neck, and on the décolleté I'm going to use another pump, but that's absolutely enough. If you use too much of the serum, you're simply going to have this foaming structure, foaming product, and it's not going to be absorbed very easily. But with dehydrated skin, the absorption is slowed down as well, so don't worry about that. Take just one pump, wait for it to be absorbed, and apply BioRelief on top of that. So same ingredients as in BioRelief, but it also has algae extract, very rich, very nourishing for the skin, very rich in flavonoids, anti-wrinkle action. There is also a rice extract, very rich in cytokines, gibberellin. So really anti-aging, strong anti-aging. Those products will not only moisturize your skin, but will also enhance the production of the enzyme HS2, which is responsible for the production of the hyaluronic acid. So you're increasing the natural production of hyaluronic acid, which is the best way of doing things. What else? I think I told you amino acids, of course, which I mentioned about, and vitamins, vitamin C, vitamin B. And finally, we're going to move to ARES and the protocols. Let me just check if there's no questions. Okay, I answered this question. Perfect. RSAK. Why do I start with RSAK? Because I'm so vain. And simply because I helped to make this product, and I'm really proud of it. That's why RSAK stands for Ares Agnes Kuzniak, and it looks beautiful and it is absolutely gorgeous and I love it. So try this one. Well, try everything, but this one is like my favorite. This product, when I was thinking about this product, when I was thinking about the ingredients, I wanted to have the ingredients in this product, which is going to help with everything, which is very important, and it is succinic acid. Succinic acid will work in a product if it's above 1%. In our product, it's 1.6%, so it is a large quantity of succinic acid. Succinic acid, which is proven to work and have influence on mitochondrial activity. Succinic acid activates succinate receptors when injected into the skin. And succinic acid is produced in larger quantities in our bodies when the body is under hypoxia, which is lack of oxygen. So then the succinic acid is produced. Succinic acid, it's like an emergency response of the body to stress situations. So by injecting it into the skin, by applying it onto the skin, you are providing extra nourishment, you're providing extra blood flow to the skin, to the organ, sorry. So really important product. Hyaluronic acid, 2 different molecular weights, and as you know, depending on the molecular weight, hyaluronic acid is going to be either pro-inflammatory or anti-inflammatory. So high molecular weight hyaluronic acid is anti-inflammatory, it's moisturizing, it's providing the scaffold inside the skin. Low molecular weight hyaluronic acid is going to have pro-inflammatory action, but it's necessary for all the redermalization processes. So succinic acid, I mentioned to you, I absolutely love it. What I'm going to introduce very soon, what I found, and it took me ages. I absolutely love those massagers. I use massagers every day on my face. I think I could be pretty proud of my jawline now and how the face looks like. So I don't have any nasolabial folds, visible ones. I'm not 21 anymore, but my skin looks absolutely amazing. But it's the combination of the BioRePeel, which I'm not going to pretend I'm not using. I am using it all the time, and I'm using Ares every 2 weeks, minimum every 2 weeks, either with microneedling or just topical after the BioRePeel. And how I use it when I do the BioRePeel, because my skin doesn't need microneedling. Microneedling is the collagen induction therapy. I've got really thick, really good quality skin. So microneedling I will do once in 2 months, maybe. Mesotherapy once a month. But I just use the BioRePeel FND every 2 weeks. And when I remove it, I apply Ares. I apply Ares and just let the product absorb. If I do the microneedling, I need to show you this microneedling pen. I think I'm just going to the separate webinar on it, maybe tomorrow. I wanted to show you this 1 needle microneedling pen, and it has those nano needles. Absolutely phenomenal. You don't really need to microneedle deep. It's enough if you microneedle 0.33 for the active ingredients to be able to be absorbed through your skin. And the results are just phenomenal. I'm telling you, the results are phenomenal, and you can use it with the BioRePeel. When you're doing microneedling with the BioRePeel, please don't do it deep. 0.33 is the depth which you shouldn't be going over, unless you're doing scars treatment or unless there is a real need for deeper treatment, treating skin to the pinpoint bleeding or bleeding, when you need collagen induction therapy. But when you're overstimulating the skin, when you're doing this microneedling too deep, too often, what are you causing? Nothing else by the creation of the fibrotic tissue. So imagine when you hurt yourself, when you burn yourself, when you cut yourself, what is your body trying to do? Your body is trying to close this wound to prevent from the penetration of the pathogens from outside. So it's creating scar. And it's the same with your skin. If you repeatedly hurt your skin, if you repeatedly cause this damage, you're going to create scar in the dermis, and then the skin is going to be aging faster. The skin is not going to be looking good. You need to think not only how my client looks like, how my patient looks like 2 days or a week after, but how they're going to look like in 5-10 years time. You need to be responsible for what you're doing. I'm not offering many treatments. I'm only offering treatments which I know they have been proven that they work. They have been researched for years. And in case of microneedling, it's 3,000 years. I think that's enough of the evidence and of the knowledge to know how to do it. And we know we shouldn't be doing it very deep. Mesotherapy, research for years and years. We know what products use. We know how frequently to do it. So what you should be doing when a producer tells you to do it once a month, you do it once a month because they did all the research. When we telling you do the BioRePeel without microneedling once a week, you do it once a week. You don't do it every day. The same with BioRePeel and microneedling. Do it between 2 to 3 weeks gap, depending on the skin. Contraindication, if the skin is dehydrated, you shouldn't really be doing microneedling. You should first of all rebuild the skin barrier, attend to this level of the moisture in the skin, and just water, it's not going to moisturize the skin, and I'm going to explain about it in the next webinar. But you need to do it, you need to know what to do. Sometimes the client comes to you and says, I would like to do microneedling, and you tell them, no, I can't do the microneedling today. Your skin is not suitable for microneedling. Your skin doesn't need microneedling. We need to moisturize it first. We need to rebuild it first. Because what can happen when you do microneedling on the dehydrated dry skin, first of all, you're going to have prolonged inflammation, which is going to lead to complications, or you're not going to have inflammation at all. And you're not going to have renormalization. So you really need to know what you're doing. And I really recommend for you to come for the microneedling training. To us, we're doing microneedling training once a month. There's a therapy training, chemical peel training. And once you train in all of that, we would like to invite you to masterclass. And masterclass is a trademark protected protocol. These are all the protocols. This is skin science. These are all the protocols which we're telling you how to treat different skin types, how to approach. So it's not about me telling you, this is the BioRePeel, it has such and such ingredients, and that's it. No, it's a really in-depth knowledge when we're teaching you how to deal with the scars, how to deal with the certain skin conditions, how to guide your customers. 1 day, very, very intense training. Of course, you get post-training support. Why are you getting post-training support? Because there's too much knowledge for you to remember. You still get some printouts, you still get some, folders, but it's really, really intense. So that's why we're offering you support in groups. Okay, what else? Amino acids, coming back to RSAK. Hyaluronic acid, succinic acid, amino acids. Very, very interesting one, glutamic acid. When you think about all the skin conditions, any dermatitis, psoriasis, rosacea, the pH of the skin is elevated. So what glutamic acid is doing is leveling the pH of the skin, is lowering the pH of the skin to the correct neutral level, to the level of where it should be. So you're helping get rid of all those dermatitis, psoriasis, rosacea problems. So very, very, very important. I'm just checking if I told you about all the ingredients. Amino acids, yes, I mentioned. Methionine plays very important role in cell metabolism, and it's a heavy metals chelator. So very strong detoxifying action on the skin. The next one, which I would like to tell you about, it's RSAA. I will check if there's no questions about products so far. No. RSAA, anti-aging. All the products, all the components of this product, of course, are phenomenal. All the RS line, these are pharmaceutical grade products, sterile products. Yes, we're waiting for the CE mark. So we applied for it, it was accepted, we're just waiting for the CE mark. 84 milligrams of hyaluronic acid, so huge amount. I don't know any other product which would have 84 grams of hyaluronic acid in a vial. Hyaluronic acid, 3 different molecular weights, signaling peptides, but the peptides which are not only responsible for signaling, for communication, so peptides which are not going to work on the nerve synapses level, but also moisturizing peptides. So peptides which will help skin become healthier by interacting with signaling protein on the skin surface. So they're going to address how the skin looks, how the skin feels. And you've got, of course, all the references, of course, all the research from the medical journals, which I added here. Very strong tissue regeneration. You've got pentapeptide free, which inhibits muscle contraction, but also it's a topical alternative to muscle relaxing injections. So why not to use it? I will show you the pictures with wonderful, wonderful effects of RSAA. Oligopeptides 34, 13 amino acids, but they would also not only brighten the skin, moisture the skin, but also will decrease melanin synthesis and tyrosinase activity in melanocytes. So lightening, brightening effect. Copper tetrapeptide, absolutely love copper tetrapeptide, but make sure that if you're using product with the copper tetrapeptide, you do not use vitamin C for at least 20 minutes. These two don't work together, so 20 minutes at least, or not on the same day. Mistral pentapeptide, collagen boosting, improving skin texture, promoting cell regeneration. Those are the products, and I know most of the products on the market. I've been working for the last X years, and I haven't seen the products with such good quality ingredients, with such choice of the ingredients, which would address so many different things with so many different problems in the skin. This one is, I just love it. Smells very medical because of the saffronel. If you want this glowy, amazing skin, my favorite procedure is mesotherapy, BioRePeel, and then I complete it with RS antioxidant, and that is my absolutely favorite treatment, and it gives you phenomenal effects. Hyaluronic acid, 2 different molecular weights, ferulic acid, vitamin E, vitamin C, saffronal, riboflavin, curcumin. What else could you imagine? What better ingredients could you imagine for your skin? It's a magic in the bottle. So if you are looking after your skin, if you are skin specialist, or if you want a great treatment in the salon, if you're a customer, ask about RS. Ask about RS in combination in the BioRePeel, and I can guarantee you're going to love the results. Phenomenal, honestly phenomenal. You see, I was applying cream earlier on my skin because I'm not using any I'm not using makeup. Well, I love doing my eye makeup, but it doesn't matter. On the skin, I don't put any makeup, so it is how it looks. Yeah, it's very glowy. It's very, I don't have pigmentation, but it's not one-off treatment. I've been doing those treatments, as I told you, for years, and I'm doing them on the regular basis. And this is what you need to tell to your clients as well. Yes, the skin is going to look amazing after one treatment, but if you want to look good when you are not 21 anymore, and I'm over 40, and I absolutely love how my skin looks like, and I'm very proud of how it looks like. But it's work, it's dedication, it's work, and it's use of the correct products on a regular basis. But with this one, mentioning about antioxidants, you can't have better collection of antioxidants. You simply can't. Curcumin, a little bit about the products, protects against the sun damage. So if your client, or if you are a customer, and if you're looking for, you came back from holidays, you had a little bit of the sun or a lot of sun, your skin is dehydrated, your skin is damaged, ask about the BioRePeel and RS. Even better, ask about the BioRePeel, mesotherapy with RS, and then microneedling with yellow RS, and you're going to be one happy customer. You're going to love it, absolutely love it. Ferulic acid, it enhances regeneration of the cell. It accelerates wound healing. It supports wound healing. It's a very, very strong antioxidant. It's anti-inflammatory, brightening, depigmenting. I need to come back to RS AK and to succinic acid. If you have the clients, or if you are a client who is prone to allergies, is prone to reaction, skin reaction, use RS AK, because succinic acid is used as the component who prevents allergies, and it's well medically proven, so this one is going to be safest for you. If you are prone to allergies, I would start with RS AK, not with RS antioxidant, because this one is very, very active. And for those rosacea prone skins, for those reactive skins, it's not the first choice. Yeah, it can sting. It's not going to harm you, it's going to repair your skin, but start with green RS. And the last one from the RS line is RS Hair Booster. Oopsie daisy. RS Hair Booster. You're going to love it. You're going to absolutely love it. Offer it to your male clients, female clients, 2 milliliters per session. And when you're using RS, it's always 2 milliliters per session. If you're treating face, neck and décolleté, it's going to be 4 milliliters per session. RS Hair Booster, 2 milliliters per session. Mesotherapy, microneedling, the results are phenomenal, phenomenal. All those ingredients are focusing on nourishing hair bulb, on bringing extra blood flow, on supporting the blood flow, on bringing all the nourishment, promoting stimulation to the hair bulb, strengthening hair, provides essential energy for the hair growth. And that's about microneedling, but maybe I'll leave it for the microneedling training. So basically, if it comes to the depth, you don't need to work deep when you're microneedling. Don't ever, ever, ever use any numbing cream. It stops cell communication. It's actually not doing any good. Lidocaine is toxic for the skin. It's not good. Can clients have the microneedling without numbing cream? Yes, of course, if you're using good grade medical pen, it's not painful. It's not painful. It's very precise. You can do it easily. You can do it on 0.33, and then it's painless. You can use nano needles. You're still going to have wonderful effect, and it's not going to be painful for your clients. So I think that's going to be it from me. BioRePeel with RS, I already told you about procedure. So we cleanse the skin, prepare the skin with Forever. Always disinfect the skin before you microneedling, always, because of the bacteria Staphylococcus aureus, which is present on the skin now in more than 50% of the population, and which can lead to serious, very serious complications and even MRSI, which is the infection of the blood. Lethal, absolutely lethal, deadly. So you need to be very careful, always at least 70% alcohol. I'm using surgical spirit or alcohol wipes. Those alcohol wipes, which you can get everywhere, 70% alcohol wipes. I actually showed you lens wipe, but alcohol wipes are coming in the same form. So draw 2 milliliters of the BioRePeel, apply to the treatment area, massage until well absorbed, wait for 5 minutes. If you see a little bit of frosting, don't worry, just leave it on the skin, wait and remove it after 5 minutes, but don't rub it, just tap it, yeah, with gauze, with water, and not to cause extra damage to the skin. Remove the BioRePeel with gauze, microneedle the skin. Don't, if there was a frosting, don't microneedle on the frosting. You know, you need to microneedle where there wasn't any frosting. Most of the cases you won't have any frosting at all. So I'm microneedling, I'm applying RS and I'm microneedling again, leaving RS to just be absorbed by the skin, and then applying BioRehydra or BioRelief, or both of them, depending on the skin need. Some of your clients do want to peel. BioRePeel doesn't cost too much peeling, but some of your clients do want to peel, do want to have this peeling effect. Then you can use the combination of the BioRePeel FND and BioRePeel Body 42% with microneedling, and they will peel. But those information and those treatments are taught during the masterclass. So please sign up. We still have spaces for the 15th of September. London Tower Bridge, absolutely magnificent place where you're going to get lots of knowledge. We have decided to include some products, selection of the BioRePeel and RS products and post-treatment cream in your starter pack. So you're going to recover your training money in their treatments, which you're going to provide for your clients. And to finish off, just one procedure. So that's the cleansing. That was the procedure with microneedling and then electroporation. And yes, if you would like to enhance the procedure, when you do the BioRePeel, you can do the BioRePeel with microneedling, then RS with microneedling, or you can do the BioRePeel and then RS with microneedling. But if you want to enhance it like really, really well, do electroporation after the microneedling. Amazing, absolutely amazing. So I do recommend it. You can use LED lamp, you can use many other treatments with it, but that's my favorite. So it's BioRePeel, mesotherapy, BioRePeel, microneedling in this order. Mesotherapy, BioRePeel, and microneedling, and then electroporation. Fantastic. fantastic, really amazing. I'm going to wait for 2 minutes. Maybe you've got any questions. So I'll just check if you've got any questions on Facebook. Stop sharing. Okay, that's me again. So let me see if you've got any questions at all. And if not, no questions. So you know everything. It means training was good. Everything is clear, and you don't need any help. But if you need any help, we are providing help. We are providing extra webinars for our customers. So these are the customers of aesthdrm.co.uk, aesthdrm, aesthdrm.co.uk, where you can purchase all the products, BioRePeel, RS, microneedling pen, microneedling cartridges. And as I said, if you are our customer, you can always message us. You can always text us. You can send us message and ask for the guidance in the treatment plan. And we'll always try to help you as soon as possible. Of course, when I'm training, you need to wait a little bit longer, so maybe till the following day, but we always help you and always provide you with the guidance. If you are purchasing BioRePeel somewhere else, you need to contact your provider. Thank you so much for being with me. I'm going to post this webinar on YouTube, so you can watch in your time. So if you want to rewatch it, or if you want to show it to your customers, because it's a reminder as well, this is professional treatment. So for the customers to know how the product works, it's very useful. But this is professional treatment, which is only performed in the salon where the professional had practical training. Important, they have to have practical training, not only watch the webinar, unless they're just doing topical BioRePeel treatment, then it's absolutely fine. And I'm thinking of the next webinar, which is going to be probably tomorrow, after tomorrow. And I was thinking of charisma. I was thinking of skin barrier. I was thinking of microneedling. And what do you think? Which one would you like to see the most? Have a lovely, lovely afternoon, and I'll see you soon.